Why are you smiling?
Morning at NTV continues. I have just been having a conversation with a very important woman in the room. And as we continue on with our conversations here on the program, of course, you need to know what's the GPS of your presidential candidate as of today, the 7th of November, 2025. So where are they? Well, Elgon region was having Yoweri Kaguta Museveni, the incumbent, but today he's taking to take a rest of the campaign trail and focus on family and matters of national importance. Robert Kasibante will be traversing the areas of Butaleja and Butebo. You do have a patch that will be receiving Mubarak Munyagwa today, and of course you also get to look at Robert Chagulanyi Sentamu. He's going to be in Mbara as well as Mbara City, and so those two should be receiving him as of today. Mugisha Mutu for the Alliance for National Transformation is also on the road today in Lamu and Kitgum particularly. That's where he's going to be taking his message of a cleaner leadership for our country, Uganda. Then we also get to look at other presidential candidates such as Joseph Mabirizi for the Conservative Party that is in Luka and Kamuri. That's where he's taking his gospel according to his Conservative Party and its manifesto. Frank Burira, who was also on the rest yesterday, is going to be picking it up yet again in Uganda, and so by and large that's where the different presidential candidates are. Nandela Mafabi is going to also be having a campaign rally in Katakwi and Napak, and Kasibante Robert for the National Peasants Party, Butaleja and Butebo, is also going to be receiving him. So the gentlemen, 8 of them, are on a busy day. Only one candidate is resting, and that's the incumbent Yoweri Museveni for the National Resistance Movement. So that's where they are going to be. We're going to be keeping you abreast with matters related to that in our subsequent bulletins, but also watch out for our election session at exactly 3:30 this afternoon to give you an expose on how the day would have gone so far for the different presidential candidates and what commitments they have been making over the course of time. Now, one of the things that have been coming through for presidential candidates is matters concerning education, security, health, and the economy. So those are the big 4 that we are looking at here on the morning show today. And more focused on health this morning, we get to have a conversation around the relevance of routine medical checkups with us. Earlier on, we heard from the Ministry of Health, and they were talking to us about some of the high-risk diseases or the public risk diseases that we should be mindful of. But, you know, they were saying signs and symptoms that not necessarily are visible, but yet if you go for a checkup, you get to know that these are the signs and symptoms you're having, and then from that checkup with a medical officer or a physician, you'll understand what kind of disease it is that you're suffering from, and the given treatment will be given to you, and then thereafter you can engage in the civic and options that are there for you right now in this season without fear of for your own health and the health of the other people around you. So it's upon the background of that we are talking about routine medical checkups, and these always open the door for you for an assessment to check your well-being status. Many of you have had that experience. You go thinking that you just have cough and flu. Then they tell you you have an infection. Say, but no, my signs and symptoms are telling me this, but you're telling me something else. That is the importance of a routine medical checkup. And so Rotaract Club of Nigeria is extending this service to Ugandans and traversing the dynamics of routine medical checkups in Uganda, and of course particularly in that area called Nigeria. So we are having the president of the Rotary Club of Nigeria, Irene, to give us an expose into these medical camps and how exactly they have changed the livelihood of people in Nigeria. Good morning to you.
Good morning.
How are you?
Oh, thank you. How are you?
I'm very good. So, yeah. Madam President, I'm glad that you're president and you're talking and concerned about the health of the community of Nigeria. Yes. As a club, I know that these are engagements that this is not the first time you're having them. You've been having them over the course of time. We want to know, why did you choose the health sector as one key area to focus on in Nigeria?
I thank you once again. Health, as Rotary, is one of our focus areas. So every year, we actually have a month where we focus on health. And we reach out in our communities where we serve and focus on health. It could be anywhere. And you know, there are different Rotary clubs, but as Nigeria, every year, since our existence, we actually carry out medical camps to actually deal with this area of health, because it's very important. Like they always say, health is life. You first have health, then you're able to do many other things. So that is one of the key things that we focus on as a Rotary Club. We've carried out several camps over the years, and Nauvuru, Bushenyi, Kisoro, but this time, because we operate in Nigeria, we said we need to touch the community in Nigeria with this health camp. Like you said, you need to find out, what's my state?
Yeah.
You don't want to be surprised and think I'm okay.
But I know that people have been surprised of the ones that you've mentioned in the different other districts that you've talked about. What are some of those surprises that the communities have had to face as a reality?
You know, especially when you go to the villages. I remember when we went to Kisoro, many people lined up, but they came probably because of their excitement that, oh, there's this service. And somebody comes not knowing that I have an eye problem. I have a dental problem, because we go check eyes, we go check dental. They come not knowing that I have this problem. And guess what? They are surprised that they have that issue and they receive treatment. So that is the beauty of actually having checkup, because you're able to know what the issue is at that point, and then you get medical attention. Yeah.
Okay. That being said, most Ugandans, one of the reasons as to why they don't seek out for medical attention is because of the cost that comes with it. And maybe they'll be told they have to use particular drugs, which drugs are not easily accessible around them. So they would rather not know what their health status is.
That is true.
How are you handling that? Actually,
this medical camp that we do is free. So someone will come to the camp and they do not have to pay anything. You will go for eye checkup, you will not pay. You go for dental, you will not pay. Go for maybe ENT, because that's the other service that we are going to offer, you will not pay. And if it is simple illnesses, probably like malaria, they will get drugs. So you don't have to worry about the cost. The first thing is to diagnose and find out what's up with my health. And that is what is most important. And then after that, find a way to address it through the medical attention and drugs and stuff like that.
All right, so who are the underserved that you're targeting for this particular medical camp in Nigeria?
So in Nigeria, there is a community that we identify that has a need, that are not able to access these services the way they are. So we've gone through the churches, we've gone through the mosques, we've gone through the markets in Nigeria and targeted those people that you clearly see are underserved. And we've actually mobilized them to be able to come and attend that camp. The schools there, exactly. Yeah.
Okay, so when is this camp going to be happening? This
camp is taking place tomorrow, 8th of November from 8 a.m. The Tropical Primary School. You can't miss it, and we'll be, of course, we are going to brand and we'll be visible, so you can't miss it. That's when that camp is taking place.
Okay, there's some people who might come and want to donate blood. Do you have room for us?
Yes, we'll gladly take you on. We actually have that provision of blood donation as well. We're working with Mengo Hospital because, of course, we are partnering with health service providers. So there will be blood donation for people who need to donate blood. Please, let's save a life. Yes.
Okay, and so it's a one-day camp?
One-day camp.
One-day camp. From what time to what time?
From 8 up to 5 p.m.
Okay.
8 a.m. to 5 p.m.
Okay, that's situation or scenario. I walk in at 4:50. Will I be worked on?
Yes, you will be worked on. We always put in that extra time for service providers. If there is somebody that needs attention, they will work on them. Okay. Yes.
All right. You're holding it in a school. What is your message to parents, especially when it comes to allowing their children have those other extended checkups away from you're sneezing a lot, malaria. You have a temperature, malaria. Everything is malaria infection. They don't have that cautiousness to actually think beyond the primary diseases that their child could get.
Yes, yes. Parents, please, let's check up our children. I want to think about it like a phone. When you want to check out your battery and say, is this battery still on?
Right.
I want to use that as an example. So checkup helps to do that, to say, is the battery still on or do I need to charge? So that is health checkup. You actually recharge and say, if it is, my health is not okay, then you address it and get the battery up. So that's I would like to use that as an analogy.
Okay.
Yes.
You have talked about the ENT, that's the ear, nose, and then you talked about what are the services?
Eye checkup.
Eye checkup.
Dental. Blood donation. Sickle cell screening, as well as mental health counseling. Mental health is a big thing these days, by the way.
Especially amongst our young population.
Exactly. So we'll have mental health counseling as well there, so that we can address that health aspect of a human being as well.
Okay.
Yeah.
The other thing that I also want to inquire about is that we're having an increased burden of diabetes, especially amongst our young boys and girls.
Yes.
Is there a consideration for a checkup on that?
Tomorrow we will not have diabetes checkup, but we'll have health specialists that can always do the quick check and refer people to nearby hospitals. Okay. Yes.
All right.
Yeah.
Okay, Irene, as we're closing this conversation, what would be your message? Because even after the camp, people still have to be mindful of their health and constantly check the battery of their health phone.
Yes, yes. I call upon you. Our bodies are our engines. Please go for checkup. Like you go for checkup in the garage, for instance, for those that drive cars, but I go back to the phone because these days everybody has a phone. As you always keep checking up that battery so that you don't miss those messages, so that you don't miss those calls.
You have a charger at work, you have a charger in the car.
You know, in the car you have it where you have a power bank.
Yeah.
You know. So please, let's check up our health, not only for our children, for ourselves. So check up your health because you give yourself an opportunity to see what is wrong and arrest it early enough and address it early enough when it is not complicated. So that's the beauty of health checkup. Please come tomorrow. We'll check up whatever the things, ENT, dental, eye, but also afterwards, let's do an annual checkup to help us. So that's my message. Check up that battery.
Yes, I did check up that battery. Well, Irene, President for Rotary Club Nigeria, thank you so much for the efforts that you are focusing on, especially